All right, good morning, and thank you very much for joining us today. Before taking a few questions, I'd like to open things up with an announcement regarding our ongoing efforts to combat heroin use in Baltimore. As many of you know, heroin is a major contributor to substance abuse disorders in Baltimore City. It has also been associated with more overdose deaths in Baltimore City than any other substance for each of the past 7 years. Many Baltimore City residents who are addicted to heroin are also likely using other illegal substances, making heroin a driving force for community issues associated with drug addiction, including crime and violence on our city streets. Simply put, there is no way to make Baltimore a safer and healthier city without an effective and coherent strategy against heroin use. Today, I am announcing a task force to examine city problems with heroin and report back on concrete recommendations moving forward. The Heroin Treatment and Prevention Task Force will work to identify ways to improve outpatient treatment for those suffering from substance abuse and related disorders. I've asked that the task force report back to my administration by July of next year. Specifically, I've asked that they provide recommendations for strengthening drug treatment options, improving access to treatment, reducing substance abuse overall in Baltimore City. The task force will also work to strike the right balance between proper access to treatment, as well as balancing the concerns of many communities and businesses who worry about the overpopulation of clinics in some areas. The task force will be overseen by Baltimore Behavioral Health System, which oversees the city's behavioral health system through specialized work groups. This task force will set out to identify the extent of heroin and other substance abuse in the city. It will also determine the unmet need for treatment in the city by identifying those who are seeking treatment but lack access to it. My ultimate goal is to increase the availability and the quality of outpatient services and to provide a more robust structure for supporting residents in recovery. The task force will also explore how to better engage the community and promote positive interactions in neighborhoods where treatment programs operate. As my administration works to implement more comprehensive reforms for heroin treatment, we'll also continue our robust efforts at curbing access to heroin on our city streets and holding dealers accountable for bringing these drugs into our community. We've seen recent progress in some examples of recent progress. Just last month, Baltimore City Police raided the home of a convicted drug dealer and removed nearly $4 million worth of heroin and cash. The drug dealer had been given a chance of turning his life around through Operation Ceasefire, and authorities were able to move quickly in with an arrest once it became clear that the drug dealer wanted to continue going down the wrong path. Now I would like to bring up Baltimore City's Interim Health Commissioner, Dr. Jacqueline Duval Harvey, who will speak a little more about our efforts to combat heroin use and the challenges ahead. Dr. Harvey?
Good morning, everyone. As the Interim Health Commissioner and also as a licensed psychologist, we understand very fully the difficulties individuals face when they are addicted to substances such as heroin. It is a very, very challenging disorder. It is a brain disease. And it is important that we support individuals with this disorder with all of the best evidence-based treatment we have and the support that they need in going down the road to recovery. And I am very pleased, Madam Mayor, to be part of this task force in my role as the chair of Behavioral Health Systems Baltimore. We believe we have convened a wonderful group of people who are very talented, very energized, very knowledgeable about the subject matter. There is a diversity in the committees that have been created, and we intend to meet up to the expectations set forth by the mayor in addressing this issue and making Baltimore's residents, those who suffer from addiction of substances, much more productive citizens and help the community as well. And I'd like to introduce Mr. Bernard McBride, who is the CEO of Behavioral Health Systems Baltimore.
Sure. So Behavioral Health System Baltimore is delighted to take up the mayor's charge and lead the organization of this task force. As the mayor has so aptly stated, this is a complicated problem, has a lot of moving parts, and this is an attempt to get everybody on the same page, bring together people who understand how to get at the scope of the problem and understand for us, help us understand the depth of need in this city so that we can build a system that really responds to the needs of the people in Baltimore City. So it's a many-pronged attempt to bring everybody together. We're engaging our state partners as well on the task force. Dr. Sam Ross, who's the CEO of Bon Secours Health System, has agreed graciously to be the chair and to lead this effort and organize many other community members that include people in recovery, people in neighborhoods who live next door to and nearby treatment facilities who have had issues, and will bring to this discussion insight on how to be better neighbors in the services that we provide, as well as faith community leaders. Our law enforcement partners will be represented, as will people from the mayor's office. So this is a really robust group of people that includes experts in treatment and understanding the depth of this challenge. So we're hoping to take advantage of the fact that we're in the midst of pretty significant change in overall health care that's been led by the Affordable Care Act, impact on expanding access to care for people through insurance. The state of Maryland has expanded its Medicaid coverage, and so we have a big opportunity here to take this time to look long and hard at what it is that people of Baltimore need in terms of support for getting out from under the effects of substance use, especially heroin. So this is a great time. We're happy to be part of it. We're happy to be leading it. And by next July, we hope to be presenting to the mayor, not just an assessment of where we are in the city in terms of our need and our treatment capacity, but also recommendations for how to proceed. And I think it's important to know that we're not waiting till next July to start our change. We think the process of having the task force involving treatment providers and others will in itself start a process of change that will start to have effect immediately. So we're happy to be a part of it and happy to have the mayor give us this charge, and we're up for the task. Thanks.
Thank you very much, Bernard. I want to thank you, Dr. Duval Harvey, for your hard work. We all know that heroin has been a problem in Baltimore for generations, and over the decades when heroin waned in other communities and the drug of choice turned to other things, heroin still had a stronghold in Baltimore, and I know that the issue of addiction touches just about every family in our city, and we need to do more. One of the first things I did as a part of my volunteerism effort was to create the peer-to-peer model, the Recovery Corps, which was using that peer-to-peer model, taking individuals who had had achieved 3 years of success in addiction to help the next generation along. And we were right here in this room in a meeting of community leaders, and someone said, we have so many smart people in this city, and we can't ever figure out why heroin has had such a stronghold on this city. We have to do something more and engage in a different way around this issue, and that's why we're here. And I'm very hopeful that we will use the resources that we have to make more clear the problem as well as the path toward a healthier community citywide. So with that, I'll open it up for questions.
Mayor, many people have repeated the statistic about 1 out of 10 Baltimoreans being addicted to heroin, 60,000. I believe that the city believes that number is much lower, maybe around 11 or 12,000. Will any attempt be done during this process to get a real scientific idea of what the scope of the problem, how many residents are addicted?
So we've already started that work. We've spent the last few months as we have been developing the ideas around the task force, because for me it's very important not to just create the task force, but for it to have meaning and for us to have a clear direction for where we want to go. And one of the things that we've been working on during that time is getting a better sense of what that number is, and it is closer to 10 or 11 than it is to 60,000. But whether we're talking about 10 or 11,000 or 60,000, the ripple effects impact every part of our city, and it's destroying families, and it's still too many. So I'm hopeful that with this group of people who are committed to getting more of our citizens in recovery, more of our citizens healthy, and battling the issue of addiction in a holistic way, we'll be able to make some significant progress and get the numbers even lower.
Madam Mayor, you mentioned treatment facilities.
I can't hear you.
You mentioned the treatment facilities
Mhm.
and they're kind of clustering areas. I'm particularly thinking about Station North area, where the city's put a lot of investment in trying to bring that area back.
Mm-hmm.
Do you view these treatment centers and these clusters as an impediment to future redevelopment in areas like that?
I think the cluster isn't the issue. It is when we have operators that aren't being good neighbors. I think when you have operators that want to be a part of the community, it doesn't matter if you have one or 20. But if you have one bad actor, and when I say that's very lax with how they with the rules of the house, and allow for the types of behavior that is destroying families to creep into their facility, then it becomes a problem in the community. So our hope is through this work to identify best practices when it comes to treatment, as well as figure out from those providers that are living well in communities, what are they doing, so we can learn and spread that with the other providers as well.
But do you see any concern, or do you feel any concern about the impact that these clusters have?
So again, it's not you're talking about clusters, and I'm talking about the bad actors. When you have a facility that is not integrated in the community, and that is not when you are in a community, you have certain I believe you have certain responsibilities, and when you have facilities that aren't meeting those obligations, it's a problem. So it's not the cluster, it's in my mind, it is the ones that aren't I think fully integrated and committed to being good neighbors in our Baltimore City neighborhoods.
Kind of two questions are kind of
Mhm.
technical. A is, how many treatment centers are there in the city of Baltimore? Is it a bigger number now, a less number?
Do we know a number?
There are 20-some of the treatment centers that usually people reference that provide high volume outpatient services, so 22 or 24 in the city.
And is that more, or is it a growing number? Is it a smaller number? Is it?
It's growing slowly. One of the points I would make, just to follow up on the questions we made, is that one of the charges of the task force is to take a look at the whole structure of treatment services. And one of the questions that will be asked is there some point at which size makes it not possible to do a good job of being in sync with the other neighborhood needs? And we're going to look at that. And that, I have to say, is a product of not just Baltimore City practice, but of the whole payment structure that starts with the federal regulations and the state regulations for how people are reimbursed for that.
Why is this, it seems like the city is focused a lot on methadone, where there are alternate treatments, like you've been working with
Yes.
which are outpatient. Why is that, and is that something you might look at?
We are looking at that, and I think that actually Baltimore has one of the more robust alternative treatment regimes in buprenorphine. It's not where we want it to be. And by the way, for those of you who know, that's an alternative treatment that can be offered in physician offices, so it's not prone to the same kind of high volume visibility. So we're encouraging that. We hope to see much more of that, and frankly, we hope in this process to have to make sure that people who are in some of the largest outpatient clinics that serve methadone get the benefit of a review of their treatment to make sure that if some among them could be better served or more conveniently served through some alternative, that they get that. And that's part of what we're trying to do, is create some synergy around getting everybody on the same page to kind of agree on what standards should be in terms of practice, because it could be that we need more places with smaller numbers. Yeah.
Is there any concern about the rise of for-profit treatment centers? I'm thinking about a specific example on East 25th Street, where there's for-profit treatment centers now entering the city, that this could lead to a proliferation.
There's always concern, but this is not a concern that's limited to, this is a healthcare concern. This is not just for this particular kind of healthcare. And I think the question of how the profit motive relates to how people get care is one that we will wrestle with and try to keep on top of. But the way to do that is to have agreed upon standards that the federal government, the state, and the local authorities agree on and hold people accountable for. And whether they're motivated in part by profit or whether they're motivated by having being part of providing a good service, they're not mutually exclusive. So I think it ends up being a matter of accountability and having proper standards that everybody's held to.
You mentioned the Affordable Care Act. Who pays for drug treatment?
The majority of services, the largest source of funding is Medicaid. So if you look at the larger outpatient clinics, the single largest source, I'd say about 3/4 of the overall dollars that come into the city of Baltimore for services, for behavioral health services, about 3/4 of it comes from the Medicaid program. So that means people who are eligible, enrolled in, have access to that service. Private insurance companies do pay, as do we use some of the block grants, which are undirected funds that we have some control over. But most of the money, for most of those clinics that you would know, comes from Medicaid.
Does the city have a position specifically on that Harwood proposed center? I know that two of the council people have submitted a bill that would result in rezoning of the area. Mayor, do you have a position on that bill and whether the center should open?
I think the law department said that, weighed in on the bill and said that it did not, it was unconstitutional. So the bigger issue for me is what prompted them to put that piece of legislation in. And that goes back to the questions that were asked before about the proliferation and concentration of these treatment facilities and how they impact neighborhoods. So for me, this work that we're doing will address that. So whether we have a position, the law department's been very clear about the legality of the legislation, but that does not solve the bigger issue, and that's what I hope will come out of the work of this task force.
Is it fair to say that this, based on what's been said to this point, that the task force is largely focused on public safety and treatment issues? And should it be looking at maybe other things like the broader economics, public education, and other driving factors and issues like substance abuse and addiction?
So I thought it was very clear that this was a holistic approach. We were looking at this from a public safety standpoint, a public health standpoint, and we're bringing in experts and people in recovery so they can inform the work that we're doing. Are we going to start at Head Start and figure out what happens to a kid in pre-K that drives them into drug use? No, I mean that's not. That wouldn't be a heroin task force. But we are taking a look at the problems as it exists today, taking a look at what resources are available, taking a look at the drivers of heroin traffic, taking a look at how people in recovery are using the services that we have available and to what benefit and what problems that exist. We are looking to take a holistic approach to this.
Why form this task force now? I mean, obviously, as you said, this has been a problem for years. Is there an uptick in heroin use? Is it overtaking cocaine? I mean,
I think the issue for me was knowing that there had to be a way for us to do things better. That this was an issue that has been persistent in our community, and yet no one has said, let's all get together. Everyone that is providing the services, health professionals, addiction specialists, people in recovery, community leaders, let's all get together and figure out how we can solve this issue. My administration has tackled these types of issues in that type of way before, whether it's the journey home and our efforts to make homelessness rare and brief. It's just, I think, a way that I attack problems, and it was one that has been persistent and I believe deserved attention.
Is there anything you can do as an executive right now to curb this problem without forming a task force?
I'm sure there are, but I mean that's and that's why Mr. McBride said in his remarks that the things that we're not waiting until July of 2015 to make changes. We're implementing changes as we go along. I think the the work that we've done up to this point with the work through the health department and combining Baltimore, I want to get the names right, Baltimore Behavioral Health and
Baltimore mental health.
yeah, Baltimore Mental Health
And Baltimore
Systems
substance abuse.
and Baltimore Substance Abuse Systems is a way, that work of combining those two very strong organizations into a stronger organization is an example of the work that my administration has done to really galvanize the players and get to a more substantial defense against the issue of heroin addiction, drug addiction, and mental health issues. So this task force is an extension of that work that we've been doing. We're looking for innovative ways to deal with drug addiction, and I talked about the peer-to-peer work that's been done. And for me, knowing that the problem still exists, and we're still losing too many people to heroin overdose deaths, it was important that we take a more comprehensive look at it, and that's what this is about.
How long has this task force been working, or when will they first start working?
After doing a lot of the background work to make sure that we knew exactly what we wanted from the task force and who we thought was vital to be on there, it'll start working soon, and we anticipate them having the report in July of 2015.
So soon, like this 2 weeks from now, next month?
Yes.
January?
No, soon, like very soon, within the next, I think within the next week or two.
Isn't there a change on the horizon of how these programs are getting funded by the state?
You know,
Can you talk about that? I don't know
Yes.
if that affects the city as much.
No,
as
it does.
affects-
It affects the whole picture, and that is the administration of the Medicaid-funded drug and alcohol services is being shifted from the current administration is through the physical health plans. So the physical health plans have the money for and the responsibility for managing substance abuse services in the state as part of their thing. It's being withdrawn from that and combined with the mental health services that are managed separately with the use of an administrative services organization that happens to be Value Options that they have chosen. So they'll be administered together. So what it does, well, the argument, which I support, is that mental health and substance abuse, number one, relate to each other. So putting them in the same place and managing them makes sense. But also, it lets the state program management offices have a little closer relationship to how the services are provided. So back to what I said earlier, we're working very closely with them around how we manage the programs that come into operation and the way in which they're monitored. So it's a step in the right direction. It's a integration of services at the state level that will help us work more closely with them in Baltimore City.
But
So it's a good thing.
is it also go to a fee for service?
Yes, fee for service for the individual providers who are used to getting, who are on the other side, used to getting a block grant, basically a fixed amount of money to serve people throughout the year. Now they have to bill, as in other situations, and keep track of their funding through billing. Yes, so it is different.
Does that affect the treatment centers in the city of Baltimore?
It will challenge many of them to come up with infrastructure that allows them to keep track of detail of what they do in a way that they're not used to, and we have an initiative to help them do that. But yes, that will be a challenge. It is a change. I think it will lead to more accountability, and frankly, it'll lead to more information, because one of the things we haven't talked about is the information available now about who's in treatment and where they're being treated is pretty slim, and that will get better with this new arrangement.
Thank you so much. Have a great day, everybody.
Hey, Kevin.
Thank you. Thank you.
Can we get a
Oh, I
list?
forgot to mention, Dr. Duval Harvey said that we have 3 Eager Beaver Task Force subcommittees that have already started meeting. So,
Eager Beaver?
Eager Beaver. Overachievers.
Why can't they be Orioles?